Hi everyone. So in this video I'm going to talk to you about respiratory alkalosis. Alright, so as I mentioned in my previous video, in respiratory alkalosis the pH is increased, that is above 7.45, and the PaCO2 is decreased, that is below 35. The causes of respiratory alkalosis, it always results from any condition that causes overstimulation of the respiratory system. The conditions can be fever, okay? So when there is fever, there is increased metabolism that can eventually lead to rapid respiration. So when there is rapid respiration, the CO2 is blowing off too quickly. So there is decreased amount of CO2 inside the lungs as well as in the blood, okay? It is same as hyperventilation. Next one is hypoxia. So when there is hypoxia, the patients are struggling to breathe, okay? So they will breathe too fast, so quickly, okay? So same thing happens with the hyperventilation, blowing off CO2 and decreased amount of CO2 in the lungs and the blood. And then hysteria or anxiety. So when the patients are anxious, they breathe too quickly. The same mechanism happens here with hyperventilation, okay? Next one is overstimulation by mechanical ventilators, okay? So when the patients are on mechanical ventilators, mostly they are sedated. So when they are awake, they kind of breathe so quickly. So watch for ventilator patients. If they are awake, sedate them, or if they are ready to be weaned off, then reduce the respiratory rate, okay? And the last one is pain. Of course, when the patients are in pain, they breathe so quickly as a compensatory mechanism, so that can lead to hyperventilation and respiratory alkalosis. Okay, and in the next video, I'm going to talk to you about the clinical manifestation. The clinical manifestations or the assessments are almost same for all kind of acid-base imbalances. There is only slight differences. So here, when it comes to the neurological symptoms, the patients are breathing so quickly, so they will be tired, okay? So there will be symptoms of lethargy, lightheadedness and confusion, okay? And the cardiovascular symptoms are related to electrolyte imbalances. So in alkalosis, potassium will be decreased. In acidosis, potassium will be increased. So the cardiovascular symptoms are related to hypokalemia. Also there will be hypocalcemia too. So there can be tachycardia and dysarrhythmias, okay? And then gastrointestinal, nausea, vomiting, epigastric pain, okay? And then neuromuscular symptoms, it is related to hypocalcemia. So the symptoms of hypocalcemia will be exhibited here in neuromuscular symptoms like tetany, numbness, tingling of extremities, hyperreflexia, and seizures, okay? And of course in respiratory there is hyperventilation, okay? Next, management. So always encourage the patient to take deep, slow breaths, okay? So encourage appropriate breathing patterns, okay? You can ask them to hold the breath, okay? Voluntary holding of breath or use of a rebreathing mask, okay? Next one, monitor ventilator patients. So as I mentioned earlier, always watch ventilator patients. If they are not sedated, sedate them so that we can improve their respirations, okay? Or if it's ready for them to wean off, slow down the rates. Then monitor electrolytes, especially potassium and calcium. If it is low, then replace, okay? Replace with IV potassium or PO potassium or IV calcium gluconate. Okay, so this is all about respiratory alkalosis. Thank you for watching.